Hello everyone, welcome to my YouTube channel Basic Information. Today I will tell you something about myocardial infarction. Normally it is known as heart attack that most of people in the world faced this disease and got died. So some more information about this disease is a myocardial infarction, commonly known as heart attack, occurs when blood flow decreases or stops to the coronary artery of the heart, causing damage to the heart muscle. The most common symptom of chest pain and discomfort, which may travel in the shoulder, arm, back, neck, or jaw. Often it occurs in the center of or left side of the chest and lasts for more than a few minutes. This discomfort may occasionally feel like heartburn. Other symptoms may include shortness of breath, nausea, and feeling faint, a cold sweat, or feeling tired. About 30% of people have atypical symptoms. Women's more often present without chest pain and instead that have neck pain, arm pain, or feel tired. Among those over 75 years old, about 5% have an myocardial infarction with little or no history of symptoms. An MI may cause heart failure and irregular heartbeat, cardiogenic shock, or cardiac arrest. Specialty and its symptoms are discussed, and it's also its causes, treatment, frequency. Most MIs occur due to coronary artery disease. Risk factors include high blood pressure, smoking, diabetes, lack of exercise, obesity, high blood cholesterol, poor diet, and excessive alcohol intake. The complete blockage of a coronary artery caused by the rupture of an atherosclerotic plaque is usually the underlying mechanism of an MI. MIs are less commonly caused by coronary artery spasm, which may be due to cocaine, significant emotional stress, known as and extreme cold, among others. A number of tests are useful to help with diagnosis, including electrocardiograms, blood tests, and coronary angiography. An ECG, which is the recording of the heartbeats, heart's electrical activity, may confirm an ST elevation if ST elevation is present. Commonly used blood tests include troponin and less often creatine kinase. The treatment of MI is time critical. Aspirin is an appropriate immediate treatment for a suspected MI. Nitroglycerin and opioids may be used to help the chest pain. However, they not to improve overall outcomes. Supplemental oxygen is recommended in these with low oxygen levels or shortness of breath. In treatments, attempts to restore blood flow to the heart and include where the arteries are pushed open and may be stented, or thrombolysis where the blockage is removed using medications. People who have a non-ST elevation myocardial infarction are often managed with the blood thinner heparin with the additional use of PCI in those at high risk. In people with blockages of multiple coronary arteries and diabetes, coronary artery bypass surgery may be long-term treatment with aspirin, beta blockers, and statins are typically recommended. Worldwide, about 15.9 million myocardial infarctions occurred in 2015, more than 3 million people had an ST elevation MI and more than 4 billion had an NSTMI. STEMIs occur about twice as often in men as women. About 1 million people have an MI each year in the United States. In the developed world, the risk of death in those who had and STMI is about 10%. Rates of MIs for a given age have decreased globally between the 1990 and 2010. In 2011, an MI was one of top most expensive conditions during inpatient hospitalizations in US, with a cost of about 11.5 billion for hospital stays. So guys, it is the information about the heart attacks disease. And if you like this video, if you enjoy this video, if you avail yourself by this video, so must like, comment, share, and also subscribe to my YouTube channel. Thanks for watching.